This is the Uptick Network Stock Day podcast, sponsored by InvestorsHangout.com. Penny stock news and interviews from the microcap world. Public information on OTC, pink sheets, and microcap stocks from around the world. With your host, Jasyn Blair.
Today on Stock Day, we have a very interesting guest. His name is Etienne Grima. He is the CEO for CardioComm Solutions Incorporated. They're trading on the OTC pink sheets under the ticker symbol EKGGF and trading on the Toronto Stock Exchange Ventures under the ticker symbol EKG. Etienne, welcome to our program.
Thank you. Pleasure to be here.
Absolutely. Etienne, I'd like to start by introducing yourself here and tell us a little bit about yourself and how you became the CEO of CardioComm.
Sure. I always had an interest in cardiovascular medicine. My background is in research, clinical research, and basic research. And I ran a successful CRO, clinical research organization, and was introduced to CardioComm's ECG or cardiac monitoring technologies about 10 years ago. And at the time, there was an agreement to work together between our CRO and CardioComm Solutions. And as we learned more about the company, we became quite intrigued at the capacity for their software to be used in a number of different medical and research verticals. In coming to know the company, I was graciously invited to join the board of directors, and then I assumed a CFO role. My colleague in the CRO became the CEO. And as the company was realigned to meet more of the mobile and digital device connectivity technologies, I had an idea that we should be moving more into the consumerization or commercialization of ECG technologies. And around that time, I took the position as the CEO of the company to see what I could do with moving the company into that area or those new areas.
Excellent. So let me ask you this. What differentiates CardioComm Solutions as a mobile cardiac monitoring company in the medical and consumer markets?
So most people will see a medical device, and medical devices are powered up by software. And when decisions are made to acquire systems or to use technology, we make our decisions largely on what we see, which is the hardware. CardioComm Solutions is the software behind the hardware. And where the difference is in the medical world is that it's the software that provides credibility to the hardware.
Absolutely.
A device like an ECG monitor may have software inside it. It's called firmware. But when you take the data off the device and you want to move it on the cloud or have people review it remotely or create reports and put them into EMRs, software manages that. And what we do, our device, our product, is only software. It's called GEMS, Global ECG Management Solution. And our technology develops tools for sensors to be put on bodies, ECGs largely, to move the data from those sensors through some sort of a portal, whether it's a Bluetooth hub or a USB cable, to a server, and then on that server environment or moving it off into a managed cloud environment, give controlled access to qualified healthcare professionals to see the data, report it, create reports, put them into EMRs, and allow billings to be done either through the US or Canadian billing services. So the software for us is a medical device, and no one works exclusively in a software-based medical device market. It's typically make hardware with software that fires it. And that's what differentiates us. And we've been doing this since 1999, FDA clearances since 1999. We have no letters to file, no warnings, unlike people who are in our space who can't make that claim. So we're credible, we're long-term, we're innovative because we've worked with lots of devices and lots of companies and lots of hospitals for many years. And that platform is our strength, and our capacity to understand what's happening in the market is going to be our strength moving forward.
Excellent. So, reading over a recent press release here, you guys have developed a new product called the HeartCheck ECG Sport. Can you tell us where you're at in the process of getting this out to the market, and what is this device going to be used for the regular consumer?
Right. So the way that devices are brought to market is you typically will develop a prototype or a form factor, prove that it can be used to do something. So here's a patch. It's already a production item. It's an orphan product. Really well made, good sampling rates, creates hospital-grade recordings. Anytime you want to bring a piece of hardware to market, you need to have it cleared. It has to be manufactured according to certain standards, has to be medical device testing, and you make an FDA application. And then there is the software side that has to be put in with it to make sure that it works according to standards. We already have FDA clearances on all the software. So this product needs its validation, testing, and FDA submission, and then it can be brought into sales into the United States and Canada and Europe. So we're very much down the line with respect to we have a working product. It's already been integrated for testing purposes and validation purposes with our software. What's needed now is that we work with the device manufacturer to get the documentation to put the FDA filing in. Now, FDA clearances could take a while. We have a lot of history with our FDA, clearances, no issues. When we came out with our first product, the HeartCheck ECG pen, from the day that we made our final submission to the day that it was cleared was 5 calendar days.
Wow.
Which was quite unusual.
Right.
So we're hoping that once we have the documentation properly aligned, because we already have the software cleared, when we make the FDA submission, we should be able to move fairly quickly through the review cycle. And when approved, the product is already to go for fairly large production runs. But it's all right now up to the documentation procedure and the FDA reviews.
Excellent.
And we're ready to go.
My guest today is Etienne Grima. He is the CEO for CardioComm Solutions Incorporated. They're trading on the OTC Pink Sheets under the ticker symbol EKGGF and on the Toronto Stock Exchange Ventures under the ticker symbol EKG. Now, Etienne, I'd like to take a step back here, and I want to congratulate you. Recently, it looks like you guys were awarded the Innovation and Excellence Award. What is this going to mean for your company going forward?
Well, it's a recognition of what we've been able to accomplish. These awards are provided through a number of mechanisms. Largely, it's because we get interviewed by large research firms to give our impression, our opinion, and our insights into how markets are developing. This is how you get these forecasts for what's going to happen in 2020. And when people call us, they generally are quite impressed that a Canadian company that isn't largely known has such a good foundation in the mobile health market. So when we give our feedback, we are identified as a company of interest and a company to watch when these groups who work as consultants, such as Frost & Sullivan, we won an award of theirs in 2012, and other groups, they talk, and their job is to talk to companies and create synergies between like-minded groups. And by giving our inputs, they see that we actually plug into the consumer market, the health and wellness market, the medical market, billings, software as a service, consumer, renewable revenue streams. And we're identified then as either an innovator or one of the top companies in certain fields. And so being named is because we've been talked to. Being named is because they have recognized that out of all the groups interviewed or spoken to, we're actually very innovative and should be brought forward in a noteworthy fashion, which helps them get their reports sold and helps them be more credible when they're making references to enable other groups to succeed. Just as an example, for years we white labeled a version of our software for GE Healthcare and sold it, or they sold it under their name. And we've been inside of the Philips Healthcare ECG services system. We built a customized solution for them. And when we do this, not everybody hears about it. So when our disclosures come out, we win awards.
Excellent. And highly touted as such. I mean, I see here you've been the 2014 Business Excellence Award winner, the Innovation Excellence Award 2015 winner. You guys are very highly touted and very reputable as a medical device company, and it's just amazing what you guys are doing.
Yeah, we're very happy. We're very happy with the recognition.
So now taking a look here. Over the last 5 years, the health and wellness, market has completely changed over. Can you tell me what innovations, what has changed over that landscape in the last 5 years?
Yeah, it has changed tremendously. In 2011, when we developed our HeartCheck ECG pen, there was a lot of interest in our company. We had a USB-connected device that spoke with a Windows-based PC. At the time, that was cutting-edge technology. Today, it doesn't sound so cutting-edge. It's very reliable. It does exactly what it should do. We're in 1,000 drugstores in Canada, and we sell the device globally. But since we came out, Apple opened up their Bluetooth stack. So Bluetooth connectivity to a very large brand of smartphone is now possible to anybody. It wasn't possible when we came out with our first product. Fitbit didn't exist. And Fitbit's everywhere. They spend millions and millions of dollars informing the market that they actually are a market for health and wellness monitoring. When we came out, our market didn't know that they were the market. Apple Watches, doing activity tracking. Samsung introducing health and wellness and vital signs monitoring. Millions and millions of dollars have been spent over the last 5 years changing the landscape for how people view monitoring their health. Our technologies now will leverage all of those millions of dollars spent. We will not need to be the ones informing people. We will simply provide a device that will be recognized in form factor and functionality like a Fitbit, but way more credible because it'll be medically cleared. Same with straps, that sports strap. People who cycle, people who jog will buy Garmin and Polar devices. They're not medically cleared. And they're being worn, though, for an assessment on someone's health or vital signs. We will bring wearable devices to the market for consumers that will have the credibility. So this change is great for us. We learned a lot in 2011, being the only people on the market at the time. Now we will be the most credible people on the market.
That's exceptional. My guest again today is Etienne Grima. He is the CEO for CardioComm Solutions Incorporated. They trade on the OTC Pink Sheets under the ticker symbol EKGGF and on the Toronto Stock Exchange Ventures under the ticker symbol EKG. Now, going forward here, what market expansion strategies are you guys developing?
CardioComm has its basic skill set has been selling into the medical markets, hospitals, doctors' offices, ECG services. The commercialization of ECGs will require much larger market access, and we are going to work on that, not the same way that the larger multinationals would do, like the Fitbit, spending millions on sales and marketing campaigns, but rather by partnering with companies who already have good devices built, who already have sales forces and their own sales and marketing efforts. Our software, our ECG services, technologies will follow their device sales through their own efforts. So with joint ventures and co-marketing agreements globally, we will have hardware companies pushing to sell their technologies with our software as an enabler, allowing us to basically get a free ride on their marketing dollars.
Right.
In addition, we have many companies looking for innovative and new hardware offerings who use our software. So we will enable their sales of hardware to better support and complement the needs of our customers. And that will be viewed by the peer groups in these areas as a competitive advantage. Our software is device agnostic, which means we can work with many, many different hardware manufacturers, whereas most, as I've mentioned, will clear a piece of hardware and have a dedicated piece of software, and a hospital would then need to buy perhaps 2 or 3 installations of 3 totally different packages versus our software, which would be one program that will allow any number of different types of ECG monitoring technologies to be employed. So leveraging other people's sales forces, market channels, their customers' needs for better software is going to be our expansion strategy, at least for the next 2 to 5 years.
Excellent, excellent. My guest again today is Etienne Grima. He is the CEO for CardioComm Solutions Incorporated. They trade on the OTC Pink Sheets under the ticker symbol EKGGF and on the Toronto Stock Exchange Ventures under the ticker symbol EKG. Etienne, sorry, we're running a little short on time here today. What I wanted to do is give you this opportunity to give out a little bit more information we didn't get a chance to get over to our listeners before we wrap up today.
Well, you can see a lot of what we have to offer on our HeartCheck website at www.theheartcheck.com. That's the consumer pharmacy and health and wellness website, which will disclose all of our past press releases and what we're planning to do moving forward. Our medical website is CardioCommSolutions.com. All of our financial information is available on SEDAR, which is on the Canadian Exchange. And on our websites, there are ways to get a hold of us either through investment relations or by calling us directly if anybody wants more information about the company as a public company or on our products.
Excellent. Etienne, it's been an absolute pleasure having you on the show today. I'm definitely interested in your company, and we hope to have you back here in the next couple months just to check up on your progress.
Thank you. I would welcome being back.